And now I'd like to introduce Tiko and Gizelle to come and speak from Queensland Positive People. Tiko is the Peer Navigation Team Leader at Queensland Positive People, QPP. He has a medical degree from Indonesia and a Master of Health Management from Qut. Passionate about the health of multicultural communities, Tiko joined the Community of Practice HIV and Mobility in Queensland. Outside of the HIV sector, he is leading a community engagement project titled Genomics Literacy in Multicultural Queensland with Queensland Genomics and the Queensland Institute of Medical Research. Gizelle is the Stigma and Discrimination Case Manager at QPP. She holds a Bachelor of Laws degree, was admitted to practice in 2013, and before this role has worked as a solicitor. Gizelle previously volunteered at community legal centres, including the HIV/AIDS Legal Centre, where she co-authored the Western Australia Disclosure Guide. Her background includes practice in both criminal and civil law. Thank you.
Thank you. Okay, good evening everyone. So I'm just going to be really quick. So QPP basically have two big programs. One is actually about testing and the other one is for people living with HIV. And the reason for that is coming back to what Gillian has explained about the 90 goals from UNAIDS. The testing clinic is a peer-based testing clinic. It is based in Forsyth Valley, but we do also outreach as well. But the main target for the rapid clinic is the gay and men who have sex with men. And then the program that I'm going to talk about tonight is actually the other one, which is the Life Plus program, tackling the other 290 about accessing the antiretroviral therapy and helping them to achieve and sustain viral suppression, which is called the Life Plus program. So there are three programs, three services within Life Plus, and the main purpose of the program is actually about self-management skill. So we don't create these services to create dependency from people from our services to manage their HIV. We want to support people to be independent in managing their HIV. And the other thing is that we always try to carefully screen everyone, people living with HIV who needs our support to identify whether the barriers that they are facing is actually barriers related to their HIV care and treatment, or is it more of a general outside of that HIV care and treatment. If it is outside of that, we still do treat that as an inquiry and refer them to appropriate services. So the first two programs that Gizelle is going to talk about is the case management and then stigma and discrimination, and then I will do the peer navigation.
The key focus of the treatment and care service is to work with people living with HIV on issues that are likely to impact starting treatment, continuing treatment, or attending health-related appointments. Our treatment support facilitators provide case management to help clients change things that can get in the way of health and managing HIV. Refugees may face pressures of securing stable housing, gaining an income to overcome financial hardship, accessing healthcare, and building a new support network in a new country with unfamiliar services and systems. Additional barriers can include negative impacts from mental health, other health conditions, or drug and alcohol use. Case management support includes assistance with planning and prioritizing competing needs and breaking them down into manageable tasks. We provide supports to clients to link in with health services and access medication. We're not a transport service, but we do help clients get to medical and health appointments and assist them in building up their capacity to manage their own transport arrangements. Mistrust, shame, negative past experiences, and trauma can also be barriers to accessing services and navigating new systems. Communication can be crucial in building rapport and trust to enable an open discussion about support needs. So we emphasize confidentiality. And we also give clients a choice about how we contact them. Where English proficiency is a barrier, we also use telephone interpreter services where they are available. We also do outreach in the community. We can meet clients at their home or in public spaces. Every person's situation is unique. By working with each client and their identified goals, our treatment support facilitators can provide support, information and linkages to other services in the community to address identified needs, to help clients build skills and knowledge to feel empowered, self-manage and stay healthy. The Life Plus Stigma and Discrimination program provides support for people who experience stigma, discrimination and HIV-related legal problems that affect their quality of life. That may include discrimination, complaints, unauthorised disclosures and other HIV-related legal matters. We provide support at a one-off inquiry level as well as ongoing case management support. We work to improve we work to improve legal literacy for people living with HIV and raising awareness and understanding of HIV-related legal issues, rights and obligations in Queensland. For people living with HIV, there can be a great deal of fear about disclosing their status and also the impact of that disclosure, especially in a new country with unfamiliar laws and where you might not have a support network to fall back on if there is an impact coming from that disclosure. We can provide clients with information about HIV transmission and the law, including public health approaches, criminalisation and civil law. We are not a legal service and don't provide legal and migration advice, but we do help clients to obtain advice on HIV-related issues. We do assess individual support needs, which may include referral to or support accessing legal and migration services. We have also collaboratively developed a template to support clinicians preparing medical reports for clients who are pursuing permanent residency visas. We can also provide additional support for visa applicants seeking health waivers. We also have a pocket-sized guide, which you'll see at the front, that addresses legal issues and navigating disclosure across many areas of life, including discrimination, relationships, confidentiality, insurance, many more. It's just a nice guide to take home with you that you can keep referring back to as something comes up and becomes relevant to you. This knowledge also gives people the confidence to seek support and ask for assistance if they have been subjected to unlawful discrimination or have experienced breaches of privacy or other HIV-related legal issues.
Thank you. So the peer navigation program is basically about sharing our lived experience as people living with HIV to improve someone's HIV literacy and skills in navigating the HIV care. We do have a diverse program, which is why we're always trying to aim to not leave anyone behind, including HIV-positive refugees. I myself is a refugee. And we do have a team all across Queensland, some of them working in full-time, part-time and casuals. There are people who are based in our office in Brisbane. There are people who are based in clinic, that's in Townsville. And then there are people who are working as community-based care navigator. So some of the example that we have done for refugee includes the supporting Medicare ineligible asylum seeker. We have the experience of supporting adolescents born with HIV, especially about the transition from the adolescent to adult care. And we also, in doing that, have been able to be flexible from doing the individual one-on-one peer navigation to a group peer support and extending our support to the parents as well. And we also share our lived experience with HIV and immigration. Immigration can be in its own trauma for people going through immigration, especially refugee. And so we share that in collaborations with stigma and discrimination case manager. So for those GPs and nurses working in GP practices, you can find information about our program on HealthShare. These are the relevant resources that you can access through the presentation slides as well. And the summary that we can just give is about providing adaptive and flexible services, being inclusive, drawing upon the diversity of our staff, and being highly collaborative within the organization and with external providers. I'm just going to try to play this video, which can give you a bit of a overview about PIM navigation and also about how to refer to our program. Thank you.